What's going on, everybody? Good morning. It's about 10 a.m. Where I'm at, I'm going to do my first training for today. And I took yesterday off. I wanted to take a little break on the arm. I usually try to train every day, not heavy every day. If I train heavy, then I'll take the next day off. With the bicep tear, I had surgery about 11 days ago, so I have to adjust how I train. I can't train the normal way, so this is kind of the safest, I would say, the safest way that I train, where I'm not using my right arm for anything, where the right arm is just to the side here. If I'm training on the table, I'm not gonna do that yet. It's too risky. So I'm trying to train as smart as possible with the right arm injury. And but to be honest with you, I feel like this training is super effective the way I've been training. So I like it a lot. So today I'm gonna do a back pressure at 90-degree angle, probably pronation through the thumb, and maybe supination. We'll see how that feels, but mainly back pressure and then pronation. So I might push it today. I don't know. We'll see. So this is 25 pounds, 10, 10. So 25, 35, 45. So I'm gonna just warm up. So still warm up, 25, 35, 45, 55, 65. In these warm-ups, I'm probably gonna do maybe 1, 2, maybe 3 reps, because again, I'm just warming up. Just fine. What do we got here? We got 25, 35, 45, 55, 65, 75, 85. So 85. See how that looks. Oh, yeah, heavy. Feels heavy. And my form is breaking down a little bit. Make it a little tighter. Yeah, form is breaking up at 85. And again, the way I'm doing it is with the whole injury. I got to do everything kind of sitting down, so I'm not using body as leverage or anything like that. It's just the arm. So I'll probably push it maybe one more. So 80, so 25, 35, 45, 55, 65, 75, 85, 90, 95. at these bigger weights, you know, the arm does this, and I am starting to feel a little bit of pain right here. This is kind of where they did that double incision where they made a hole here, here, and then here, and they put the tendon through a hole here, and they said they put a button on it. So it's supposed to make it stronger. So hopefully that makes it stronger. All right, I'm gonna rest a little bit, take a couple minutes of rest, and I'll be back. All right, so I just had about a 5-minute rest. Let's see if I can even lift this. It's pretty difficult with this arm here. I'm already starting to get a little bit of pain. So, and the key is gonna be try to keep this 90-degree angle as much as possible. If it goes here, nothing too crazy. I'm okay with that. I mean, in a match, if you're here, great. But if they're here and you still get them back, you're still good. No, not 95. Okay, we got 90. $90, not good. So it's all right. So that's fine. We'll count 85. Again, I don't want to go too crazy. I feel good. So it's not that I'm tired or anything, but I can't push it as hard as normal with the arm. So that's fine right there. Now I want to see how it feels when I'm a little bit closer here. Because you don't want to just train this spot right here, which is fine. You also want to be a little bit closer here. Because most of the time you're trying to get here in the match. You don't want this to open up. 90 degrees is more right here. You also want to train this spot right here when you're in. I mean, the closer you are to your hand, the closer it is to your body, the stronger you are. So you also want to train that spot right there. The way you train that, so again, I'm just gonna mimic match, so that's probably like right here, and I'm gonna just lift. Okay, so 3. Go. That's at 9. This is 90 now. Oh man, tired. I'll take another couple minutes break, maybe 5 minutes. All right, I put on a free sleeve right here. I have a little bit of, starting to get a little bit of, I wouldn't call it pain. I forget what it's called. It's early. So a little bit of pain right here. So I put a little free sleeve to basically get the inflammation down a little bit. And then we're gonna hit it again. So again, this is 90 pounds. I'm trying to work on this angle now. So this is, I would say it's more of a 45-degree angle. So I want to get that starting spot in the match where you're right here. I want to get that strong. Let's see what we got. Much better, much better. So we got 5 reps. Yeah, it opened up to, I think, right here. Again, which is fine. So I'm okay with it. I'll take the 5 reps at 90 pounds. I'm not gonna go higher than this. I'll just keep it at 90. I'm gonna go down. Now I'm gonna work a little bit more. Try to do some reps, some holds in here. Okay, that's good. I'm happy with that. I maxed it, pushed it to the limit. Now I don't want to overdo it, so I'm done with that. So I'm gonna see now how pronation is gonna be tough because you're also using this right here. So let's see how pronation feels. Yes, I really hate training back pressure and then pronation right after because you already maxed this out. So I usually, when I train, I'll just train, back pressure one day, pronation another day to kind of give them time to rest. So but let's see how this feels. 25, 35, 45, 55. Let's see how 55 feels, if that's good warm up. All right, good. 2, 3, 4, 5. Looking good. Could just be that the arm is warm, so 55 feels like nothing. That's good. 5. I'll do a bigger jump. Let's do a 20-pound jump. I think that's 25, 35, 40, 65, so 75. Let's see how this feels. So my max on pronation through fingers, through thumb is, I think it's 103 pounds or 105 pounds. I think I hit that maybe a month and a half, 2 months ago, something like that. Yeah, probably about maybe 2 months ago. So let's see how it looks now. But again, that was with using the whole body, and I was kind of in that Devon spot, just using all leverage. So this is just sitting down. So I don't expect it to be high at all. Maybe 90, maybe 95. I don't know. We'll find out at the same time. So let's see how 75 feels. Feels all right. It's still opening up a little bit. So we'll do smaller jumps. 35, 45, 45, 55, 60, 85. Too tired. So I'm gonna try to move it a little bit more closer here. Let's see if it makes a difference. Too tired, just too tired. So now you know. So I recommend now training back pressure and pronation at the same time, same day. Save it for different days so you can really maximize everything. So I'm not gonna push it. This is it. Now I'm gonna just lower down the weight, and then I'm gonna do not holds. I'm gonna do pronation reps. I want to just get some reps in. That's it. Everything feels super heavy today. Appreciate you guys watching. I'm gonna call it a day this morning. So that's my morning, and I'll probably do an 8 o'clock, 9 o'clock session too. Let's see how I feel. Appreciate you guys watching. Make sure to click subscribe, support. Really appreciate it, especially, you know, when you're a small little YouTube channel. Every subscriber helps. So really appreciate the support. Thank you guys for watching, and wish you guys all the best in your journey. You know, this sport is, to me, it's special. Not a lot of people understand how much actual training you gotta do to get small gains. It takes a very long time. It's not like any other sport where you can just do it sometimes. So this is what we do, is very special. So I salute to all of you guys putting in the work every day to get better. You know, that's what it's all about. It's just being better than yesterday. You know, it's a battle, you know, with yourself to get stronger every day, every time, get technically smarter on the table. So again, salute to you guys, and I wish you the best of luck in your journey. Thanks, everybody.
Hey everybody, it's Dr. B. We're going to talk about the supinator muscle. The supinator muscle is just on the outside of the elbow, and it's really important if you do any sort of racket or throwing sport. And what I'll start with, if you look, we'll get the middle roller, and I'll go down with the elbow bent preferably, and then I'll open and close or supinate, pronate my wrist, and I'll feel that bone or the radial head moving around. And so you'll get on it, you'll squeeze it, and there's gonna be a tender spot, almost kind of numbing, because the nerve can become entrapped in that tissue, and often you gotta free it up. So I found it. Now what I'll do, I'll squeeze, and then I'll palm down, palm up, pronate, supinate. Then I'll move my roller contact slightly up, pronate, supinate. So I'll work the lower part, the up. As you can see, I'm utilizing the roll flex to treat my forearm flexors and the pronator teres. Your forearm flexors are the muscles here. They bend the wrist, they curl the fingers. The pronator teres runs right through here, and that's what's gonna pronate the wrist. So I'll get the roll flex on the third setting, set it on my hip. I'll slide my arm right through so that middle roller is right in the middle of the forearm, and I'm right on the flexors, and I can feel a big knot. A lot of people have this knot right in the middle of the flexors.